The Keith Haring Fellowship is a one-year program for nurse practitioners
that's designed to help teach them to focus on LGBTQ plus healthcare.
To extend their learning process outside of school in the real world, and to anchor the practical information that they've learned in school in a real way to a passionate, embodied commitment to LGBTQ health.
Because it's not something taught in our schools in any curriculum, physician, NP, PA, and so we're trying to bring NPs forward as stellar LGBTQ providers.
It offers people humane and engaged healthcare experiences that were not really very available to Keith and his contemporaries.
Callen-Lorde exemplifies in a lot of ways what Keith would have wanted. So for us, it's a very natural collaboration.
In all medical education programs, so physician, PA, NP, there was a meta-analysis done on the amount of hours that are spent on LGBTQ care in these schools, and it ranges from 0 to 40 hours, with the average being 5 hours total in an entire education program spent on LGBTQ care. And that's just not enough.
We had 2 paragraphs for, I don't even want to call it for, care of LGBTQ folks, if that's what you want to call it, because it was literally just, I don't even remember. That's how you know. It was just 2 paragraphs. I have no idea.
We know here working at Callen-Lorde that our communities require a lot of extra attention and care in areas that until you come to Callen-Lorde, or unless you really seek out the knowledge, you have no idea. You just can't even comprehend all of the aspects of real specialized care that we're offering.
The Keith Haring Fellowship is basically starting out work as a primary care nurse practitioner, but at a nice, gentle pace. As a fellow, we had less patients to start with, and with preceptors at every session for a long time.
I would describe the Keith Haring Fellowship as another education. It's hard. It's not easy. It's rigorous. Didactic sessions, and you're seeing primary care patients, and we have work outside of the clinic, but it's so worth it.
It's working as a brand new nurse practitioner, which is scary, but with a huge safety net. I'm talking, I have every single Wednesday, Rona Vale, a legend in the field of HIV care, who is just sitting right here waiting to answer all my questions.
Just learning and having this mentorship and having access to so many people and so many resources that the average, nurse practitioner out of school would not have. It's amazing.
So the fellowship was starting out a job in a new role that's intimidating, that's scary, that's a lot of responsibility, but with a safety net of extra help whenever you need it. It's everything that you wish that you could have when you're new that you usually don't.
What the Nurse Practitioner Fellowship achieves is it achieves empathy. One of the main purposes is to treat people with dignity and respect.
We love Callen-Lorde. There are people, it's where Keith would be going, it's where so many of his friends would be going. This is our community. We have a stake in Callen-Lorde, and they're a model for the rest of this country.
Year 1 has been a dream. It's been amazing. I can't tell you how fulfilling it is to see a program that we have spent so much time building thrive, and thrive during COVID, not even just thrive in a perfect year.
It's been so fun because the team is so fun to work with. Brittany and James are fabulous, and they have evolved as beings, as individuals, as providers in such great ways.
A big part of the fellowship in its mission was to teach providers how to provide this care and how to get competent enough in it that we would feel confident to go out and work in a clinic where they don't provide trans healthcare and be that expert.
I kind of figured that this fellowship would do a lot, but I didn't think that it would do a lot as far as myself, like as a person. You know, I knew I was gonna learn a lot and go back to Atlanta and be like, oh, we need to do this many milligrams. Like, that's cool, that's cute. But it taught me a lot about myself too, as a person, as a provider, as a peer, a colleague.
Hopefully I get to take everything that I learned here and bring it somewhere else and take these little seeds and grow some beautiful queer flowers in other clinics.
Being a cis woman, a person of color, a lesbian, you know, a masculine presenting lesbian, like I'm all of that. That's not really what people want, you know. So to be all of that and to be in this position and to really, I had to come out of imposter syndrome. Like, it was so much that I had to do to finally realize, you know what, like I'm here, like you here, you know, like accept it, you're here. So yeah.